Welcome to Pediatrics and Neonatology. This video is about 12 tips to maintain baby's head shape. Babies have very sensitive and moldable heads, which is why many babies are at risk for developing flat heads. You should always put your baby on their back to sleep. However, this safe approach to sleeping also has one side effect. When babies lie in the same position for too long, they can start to develop flat or asymmetrical head shapes. There are also some babies who are simply born with flattened or asymmetrical shapes due to their position while in the uterus before birth. So, preventing a flat head in infants often involves simple strategies to promote proper head shape. Here in this video are a few things that you can do in order to help maintain your baby's head shape and prevent flattening. Number 1. Switch feeding positions. During breast or bottle feedings, alternate which arm you hold your baby in while feeding them. This prevents excess pressure always being on the same side of the head. If you believe your baby may have a flat spot, then begin completing feedings so that the non-flat side is the one resting on your arm. Next, start visual tracking activities with your baby at birth. Use black and white cards or dark colorful toys for young babies, since lighter colors are still difficult to see. Tracking is another opportunity for your baby to strengthen their neck muscles and develop more head control, which are essential for head shape. It also helps the baby understand that there is a whole big world out there to look at. The shadows created by the sunlight on the floor or a plant all make for fascination for the baby, and they are a good visual tracking activities. Another important step is to limit the time of the babies in devices or equipments. Babies should spend less than 90 minutes in devices per day, and less is even better. Babies being situated into carriers, car seats, swings, bouncy seats, or even the boppy pillow on their back keep the baby in the same semi reclined position, leaving them with little opportunity to strengthen and stretch their muscles. Now, another useful tip to maintain head shape: avoid soft surfaces. Use a firm mattress in the crib, as soft surface may contribute to head flattening of the baby. Next is change sleeping positions. Alternate the direction your baby's head faces while sleeping. This can be done by changing the position of the crib or changing the direction in their bassinet. Babies naturally turn their heads towards interesting stimuli, so changing the position may encourage them to look in different directions. Think of a schedule such as Monday, Wednesday, Friday, and position your newborn's head to the left side. Then on the Tuesday, Thursday, and Saturday, position to the right. On Sunday, position to the center. It doesn't need to be this exact schedule, but the idea is to give the opportunity for all areas of the back of the head to receive pressure during sleep. Now, next is begin tummy time starting at birth when your infant has an awake period and he or she is supervised. Get down on the floor to your infant's eye level and engage with them. By 8 weeks, 20 minutes a day is the goal. After every diaper change, or after every feed, or even after every nap, gently roll your baby onto her tummy on your forearm, your lap, or on the floor. By 3 to 4 months old, infant receiving 90 minutes of tummy time per day, they are shown to develop subsequent milestone more smoothly than those that do not. So, tummy time allows for your baby to strengthen their muscles in their neck, arms, and back and coordinate their movements. It is good for your baby to feel the weight of the gravity while on their tummy. The earlier this occurs, the easier they will be able to move their head into different positions on their own. Now, another useful tip: alternate direction during diaper changes. Especially as babies get older and as their visual system get more mature, they prefer to look towards you. For every diaper change, switch the direction of their head and feet. If you are changing a baby's diaper while on the floor, it is a wonderful opportunity for the baby to be positioned in the midline and look you directly in the eyes. If you are starting to notice a flat spot, then position the baby on a changing table so that when they are looking at you, they are getting pressure on their non-flat side. Now, another useful tip is consider front carriers for your baby. Back carriers should be avoided. Front carriers allow you to be close to your infant without putting any unnecessary pressure on the back of their head. Next is hold and carry. Because holding and carrying provides opportunities for different head positions. So, hold and carry your baby in your arms as much as possible. Now, next is supervised playtime. During playtime, place toys or interesting objects on different sides. This encourages your baby to turn their head in various directions. Now, this is very important. Regular checkups. If you notice that your baby is constantly moving their head to one side during sleep, despite the way you lay them, then consult your pediatrician to check for any neck tightness and a potential referral to physical or occupational therapy. So, keep regular appointments with your general physician or pediatrician who can monitor your baby's development and address any concerns with a referral to a pediatric physiotherapist if they are concerns about your baby's head shape. And finally, it is important to remember that you should never buy any type of positioning devices which are found online or in stores that claims to help avoid flattening or keep the head shape rounded. These devices can be very dangerous and pose a suffocation risk. So don't forget to ask your doctor before beginning any kind of treatment on your own. Now, it is also important to know that many newborns have slightly uneven heads. Now, what causes a baby's head shape to appear uneven? Sometimes a newborn's head is molded unevenly while passing through the birth canal. Babies are born with soft areas on their heads which are called fontanels. The skull bones in the soft spots haven't yet grown together. The soft spots allow a baby's relatively large head to move through the narrow birth canal. They also accommodate a baby's rapidly growing brain during the infancy. A newborn's head that is shaped unevenly right after birth often rounds out over time. Now, in other cases, a baby's head shape changes after birth. This is a result of pressure on the head when the baby lies in the same position often. Spending too much time lying flat in one position can lead to an uneven head shape. This is known as positional molding or positional plagiocephaly. Now, positional molding might be most noticeable when you are looking at your baby's head from the above. From that view, the back of your baby's head might look flatter on one side than on the other side. The ear on the flat side might look pushed forward. Now, is an uneven head shape cause for worry? Positional molding is generally considered a cosmetic issue. Flat spots related to pressure on the head don't cause brain damage or interfere with a baby's development. Now, as a baby gains better head and neck strength and learns to roll over, pressure on the head is more evenly distributed on the skull. And over time, a newborn's uneven head typically evens out. Changing a baby's position often and encouraging tummy time while a baby is awake also may help. I hope you liked my video. Thank you and subscribe to the channel and keep visiting and watching the videos.